Hello and welcome to other structures of the head, neck, and face. We will be talking about glands and nerves and blood vessels and the endangerment areas within the neck in this video. We are actually going to begin on page 270. And I'll get that up here in just a second. All right, here we are. Other structures of the head, neck, and face. And make that a little bit bigger. Okay, so obviously everything is sort of situated here without the musculature attached. So it is difficult sometimes to pick out these structures when you don't have the muscles for reference. You know, for example, SCM, you know where that is. So I'll try to point to myself where you might be able to feel some of these things. Okay, so the first thing that I do want to mention, of course, is that you have this very large carotid artery that runs up the side of the head and neck. Now, the carotid is going to dip into the skull here, but it also has some branches that go up the side of the head and actually run superficial to temporalis here, okay? Really, the carotid artery, the common carotid artery, brings a lot of blood from the heart directly to the brain. So it's pretty important. Anyway, you can palpate the carotid artery because it is relatively superficial and it has a pulse. It's an artery, so it has a pulse. So if you put your fingers right here, just distal to your mandible, in between SCM and your trachea, there's a little dip there. You should be able to feel a bump, bump, bump. This is where you take your pulse in your neck whenever you've had to do that for maybe a health class or something like that. When you had to time it and see how many beats per minute you have, you're actually feeling the common carotid. So that one's not that difficult to palpate. And remember, folks, when you are working on a partner or on a client, if you feel a pulse, just move your fingers, right? If you feel a pulse, get off of it. You're not supposed to be hanging out on the carotid artery, but if you go over it, it's not going to hurt it, okay? So with the common carotid artery, we have a bunch of other little arteries. We actually have a facial artery that runs up the sides of the mandible, okay, towards the maxilla and zygomatic bone. And like I said, we have branches of the carotid. We have the superficial temporal artery, and then we have some other branches that kind of come out and supply blood to the facial muscles, okay? Next to the common carotid artery or branches thereof, you have the external auditory meatus. So the common carotid is going to run, well, again, these are branches of, but it doesn't matter. I'm just going to use that word. Right anterior, just anterior to the ear, okay? But you see what else runs just anterior to the ear? They're kind of in the same spot. This is the facial nerve, okay? Now, this nerve actually exits right down here. You can't see it. Then it comes up the side of the skull right there, right where this blood vessel is, and then it starts to branch off. The facial nerve innervates quite a few facial muscles, and it is just anterior to the ear here, which means that if you are working on masseter, you need to kind of watch where you are. You don't want to be high up next to the ear here. You want to stay on the ramus of the mandible. You can move all the way up to the zygomatic bone, but again, you need to stay towards the front of the face, not towards the ear, because you can press on the facial nerve there. And it'll send a bit of a zing if you hit it, okay? Now, you have other structures here too. You have glands, specifically the parotid gland. If you get on the parotid gland, your partner will probably know. This is a salivary gland. The parotid duct right here delivers saliva directly into the mouth. And you have some other little glands around here as well. You have the submandibular gland. And again, these are salivary glands. So working around the face, you just have to be careful where you are. You have to touch with intention. So you know that if you're way back here next to the ear, you're most likely either on the facial nerve or a branch of the carotid artery or on the parotid gland. And you don't want to be right there. So when we work the masseter, you want to be more anterior. You can see where the masseter is in relation to the parotid gland. So we're going to be right about here to work the masseter. Okay, not way back here. That's just an important point to make because a lot of students do work close to the ear and they're not paying attention necessarily. It's not going to hurt your partner because quite honestly, you're not going to be digging in there, but it still feels a little weird and you don't want to get next to the facial nerve here, okay? So we're going to stay more anterior on the face in order to work masseter. Okay, temporalis is kind of the same thing. When you get on it, it's so thin that it's sort of hard to feel in the first place. So these structures, the blood vessels and the nerve, you'll never feel in there. Okay. However, like I said, we're not going to be digging in on temporalis necessarily. So it's not, you're not really endangering any of these structures there. If we move a little more inferior, we have the thyroid cartilage. Well, let's start with the hyoid bone, which is up here. Of the hyoid bone. Then you have your thyroid cartilage. It's right there. It's your Adam's apple. I just swallowed so you could see it move up and down. See, it's right there. That's the thyroid cartilage. Just below that, you have something called cricoid cartilage. And then just below that is your thyroid gland. So it's going to be right in here. Okay, your thyroid is low in the anterior neck. Again, I'm not suggesting that you need to worry about these because you're not going to be working like on someone's trachea. You just aren't. But you will be working on SCM, which crosses just in front of the thyroid and the trachea here. Okay. So a couple of things that I want to point out. Okay, so again, here's the common carotid artery. Like I said, it's rather large. It is deep to the SCM. However, you usually can feel it, especially up near the mandible. Okay, but it's superficial to the other muscles there. So working the SCM, you need to be careful about pushing directly in, which we're not really going to do. We're going to grab the SCM rather than pushing in because we just can't do that. There's too much in the area. Okay. That's a really good picture of the facial nerve here. Just want to show you this real quick. Move this over. So again, here's the branches of the facial nerve. There are quite a few, and you can see how close to the ear it really is. So we're not going to be pushing directly in front of the ear here. Okay. We just have to be mindful of it. This is the vertebral artery. It runs through the intervertebral foramen, right? Those transverse foramen there. You don't have to worry about this one. It's too deep. You're not going to hit it. Okay. Just know that it's there, like everything else. There's the parotid gland and the thyroid. So I wanted you to see the relative position of the thyroid to SCM since we were just talking about that. SCM does cover the thyroid just a little bit. But like I said, you don't really have to worry about that because we're going to be, more grabbing onto the SCM rather than pushing into it. Okay. You also have a bunch of cervical lymph nodes. You don't necessarily need to worry about those unless they're swollen, in which case you probably should avoid the neck area altogether because a swollen lymph node indicates an infection of some kind that the body is trying to fight. All right, this is what I wanted to show. So here's the brachial plexus. we've already seen this, and we've already talked a little bit about the brachial plexus, of course, because we were talking about the scalenes, but here we are. So here's anterior scalenes and middle scalenes, and then you can see how the brachial plexus exits here, okay? Then dips underneath pec major, or I'm sorry, pec minor. Then it's going to go under coracobrachialis before it makes its way down into the hand where it's going to branch off. So there are several places where the brachial plexus can be pinched. Here at the scalenes, pec minor, coracobrachialis, and it's not just the brachial plexus here, it is also the vertebral artery, I'm sorry, the axillary artery and the axillary vein here. So this is a neurovascular bundle. We will be talking about a condition called thoracic outlet syndrome that involves the brachial plexus here. So I wanted to revisit that, even though we were talking about really nerves of the face, we also have nerves of the neck. This is the brachial plexus, and then there's a cervical plexus as well. The cervical plexus exits a little higher up, and it's the same type of thing. It has a bunch of nerves sharing a sheath, and then they branch off and become individual nerves, okay? The cervical plexus, though, doesn't have as much to do with the arm, of course, as the brachial plexus, and doesn't cause as much trouble typically as the brachial plexus does. Okay, now one last thing that we need to talk about, and I think I'm going to use this image to do it because this is a good one. All right, so there are two endangerment areas in the neck, okay? There is this one here. This one is called the anterior triangle. Anterior triangle. I can't, it's very difficult to write with without a stylus here. The anterior triangle has the trachea, the common carotid artery, lymph nodes, the jugular vein, which we haven't even mentioned yet, has the jugular vein, okay? So all of these structures are within the anterior triangle. Anterior triangle, okay, here, here, and here. So the borders are the mandible, the trachea, and the SCM. Mandible, trachea, and SCM are the borders for the anterior triangle. And like I said, there are quite a few endangerment structures there. We have blood vessels, we have lymph nodes, we have, the trachea itself, and of course the thyroid gland. So there's lots going on in the anterior triangle, but that is an endangerment area here. Now, if we go here, here, and here, we have the posterior triangle, which is another endangerment area actually. And it is the SCM, the clavicle, and trapezius. SCM, clavicle, and trapezius are the borders of the posterior triangle. And mostly in the posterior triangle, we have the brachial plexus and the axillary artery and vein, okay? So we don't have as many structures close, close up to the skull, because most of this is covered with muscle here. This is all muscle back here. But lower down towards the clavicle, again, we have the brachial plexus and some blood vessels. So this is the posterior triangle. There we go. Okay. So those are, like I said, legitimate endangerment areas, anterior and posterior triangle, you should know, especially for testing purposes and things like the MBLEX. It's important to know the difference between the two and roughly what structures are in each. Okay. All right. Other structures of the head, neck, and face. The end.